So thank you for joining today's webinar, Beyond the Pandemic, Health System Change to Protect Children and Adolescents from NCDs. My name is Alafia Samuels. I'm speaking to you from beautiful Jamaica, and I'm the chair-elect of NCD Child. And so, you know, this seminar is taking place against the background of the impact of COVID-19 has had on the health systems and on the health of children and young people, including those suffering from non-communicable diseases. We know that emergency mitigation measures for COVID has meant that there has been less access to care, including to NCD care. And we also know that having an NCDs makes you more vulnerable to having COVID and to having worse outcomes. We estimate up to 1 million, up to 1 million child deaths because of the COVID epidemic. But of course, the evidence is not in yet, and we will hope it will be much less than that. We realize, especially in the global South, that the COVID pandemic will be with us for maybe a year, 2-3 years going forward because of our very low rates of vaccination. So in that context, we have to push forward with strategies to protect our most vulnerable children as our services get reestablished, even within an ongoing COVID epidemic. So throughout the discussions today, we want to encourage thoughtful dialogue about the health system changes that are needed to protect young people and the importance of engaging young people as active and positive change agents. I would like to thank AstraZeneca Young Health Program for their ongoing support to NCD Child. And now I would like to introduce our moderators for today. Our first moderator, Paula Knipe, received her LLB degree in 2017 and LLM in 2020, so Masters in Law, both from University of Cape Town, and she's currently a doctoral researcher at the Socio-Economic Rights Project at the Dular Omar Institute. Paula's research interests include gender equity and women's rights, access to justice, and socio-economic rights. Her current research is focused on the legal frameworks around non-communicable diseases in South Africa, looking at food systems, the double burden of malnutrition, and intersectional discrimination. Omnia El Amrani is a young medical doctor from Egypt pursuing plastic and reconstructive surgery. She's currently the liaison officer for public health issues at IFMSA, representing the voice of over 1.3 million medical students and collaborators, and is in collaboration with the United Nations, WHO, climate change. She's also a commissioner of the Lancet Chatham House Commission on Improving Population Health Post-COVID, and a member of the United Nations Children's Fund Youth Leaders Program. So welcome to all, and over to Paula. Thank you.
Hello, everyone, and thank you for joining us. Today's webinar is being presented by NCD Child, a global multi-stakeholder coalition championing the rights and needs of children, adolescents, and young people who are living with or at risk of developing non-communicable diseases. I'll be moderating the panel session, and Omnia will moderate the audience Q&A session. Just a quick run through of the agenda. We're currently busy with the welcome and introductions now. We'll then have the panelists opening remarks for 30 minutes, followed by a Q&A session, and then the closing remarks to end at the hour. Before I introduce our panelists, I'd like to cover a few housekeeping topics. Today's webinar is being recorded. We will be able to share a link with you after the event is complete. We welcome you to revisit the content yourself and share it with colleagues. We invite your comments and questions. Please feel free to use the Q&A chat function to submit your questions, and we will try to address all questions time permitting. If you'll allow me to introduce our panelists, the first speaker is Dr. Blum, who is the Emeritus William H. Gates Senior Professor at Bloomberg School of Public Health and the immediate past director at Johns Hopkins Urban Health Institute. He has edited 2 books and has written over 325 journal articles, book chapters, and special reports. He's the past president of the Society for Adolescent Medicine and Health. He has served on the American Board of Pediatrics. He is the past chair of the Guttmacher Institute Board of Directors and was the inaugural chair of the National Academy of Sciences Committee on Adolescent Health. In 2006, he was elected into membership into the NAM. He's a consultant to the World Bank, UNICEF, and the United Nations Population Fund, where he recently authored the guidance on adolescent pregnancy. He is the principal investigator on a 10-country study of gender norms and their consequences among young adolescents, and co-PI on a 3-country study on adolescent mental health in Kenya, Indonesia, and Vietnam. Our second panelist is Dr. Aatekah Owais, who is a research associate at SickKids Center for Global Child Health under the supervision of Dr. Zulfikar A. Bhutta, and led the in-depth evaluation of indirect effects of the COVID-19 pandemic and response on women and children in South Asia based on actual data from health information systems. She's currently leading the Exemplars in Maternal Anemia project, which is being conducted in 6 countries across Africa, Latin America, and Asia. She's providing technical oversight for this project, including quantitative analysis of maternal anemia data sets, as well as the planning, coordination, and implementation of qualitative studies in the 6 countries. She has more than 10 years of research and consulting experience in maternal and child health and nutrition in low-income settings, including conducting monitoring and evaluation of health and nutrition intervention and surveillance programs. Aatekah has a PhD in epidemiology and an MPH in global epidemiology from Emory University, Atlanta. Our third panelist is Dr. Simone Spence, who received a medical degree from the University of the West Indies in 2004, with a master's in public health in 2008, and is now pursuing a doctorate in public health from the same institution. She is currently the Director of Health and Promotion and Protection Branch in the Ministry of Health and Wellness, Jamaica, with a direct responsibility and oversight for all health programs relating to health promotion, non-communicable and communicable disease prevention, surveillance, environmental health, nutrition, waste management, and veterinary public health. She is also a part-time lecturer at the University of West Indies, Mona campus, in the Community Health and Psychiatry Department. She has 17 years of experience in primary health care and public health in various capacities at the parish, region, and national levels. Our fourth and final speaker is Dr. Kerry Kalweit, who has been living and thriving with type 1 diabetes for 17 years. She currently works as a medical doctor in the public health sector in Johannesburg, South Africa, and serves as the general manager for a registered nonprofit organization called Youth with Diabetes. Youth with Diabetes was established in 2005 to empower children and young adults with diabetes to live happy and healthy lives. She's also involved in ongoing diabetes research and advocacy within South Africa to promote patient-centered care. So if you'll allow me to invite our first speaker, Dr. Blum, the floor is yours. Please go ahead.
Thank you. Excuse me. Thank you very much. It's a tremendous pleasure for me to be part of this really esteemed panel and to think about what are some of the issues that young people today are facing and will persist over time. Next slide. I'm going to be presenting briefly some data from recent research that we have done as part of the Global Early Adolescence Study. That's what GEAS stands for. And this is a longitudinal ongoing study in 10 countries, 12 sites around the world. We're focusing our data that I'll be presenting on Shanghai in Indonesia, 2 sites, Denpasar and Samarang, in the DRC, Kinshasa, Blantyre in Malawi, and Ghent and Antwerp in Belgium. So as you can see, it ranges from low to higher income countries. The questions that we're focused on: 1, how do young adolescents experience preventive and health practices and education disruptions? 2, what is the impact of COVID on young people's mental and physical health and well-being? And within this context, I'll also be talking about some of the sustained impacts. The way this study was and is being done, because it's ongoing, is a mixed method study, which is to say we're collecting quantitative data from about 400 to 600 young people in each site around the world. And we're collecting qualitative data. The focus group qualitative data we collect twice, 9 months apart. And the quantitative data we're collecting 3 times over an 18-month period to look at change. Next slide, please. So let's jump in and look at some of what we're seeing. 1, you cannot talk about COVID without talking about the profound economic impacts that it has in terms of job loss, income reduction within families. And what we see everywhere where we look is that between 1/4 and 2/3 of respondents indicate job loss and or income reduction at a family level. And if you look at the slide closely, what you see is that sub-Saharan Africa in both Kinshasa and Malawi have been most extremely hit. And this is going to be a sustained impact over time. We also see some interesting gender differences in how young people respond. So for example, in Malawi, we see a significantly higher percentage of girls reporting economic impacts. In other sites, such as in Shanghai or in Kinshasa, boys talk about it more. But no matter how you slice it, the economic impact is profound. Next, please. Next, please. Thank you. Another impact that will have sustained consequences is on academic performance. So you have 2 things perhaps going on. One are shorter term concerns about grade completion. And here what we see is that there is very high level of concern, nearly 50% in all sites. But when you look at the panel on the right, what you see are what boys and girls in these sites anticipate to be the consequences of COVID. And one of the things that we have seen way before COVID, over the last 10 to 15 years, is this growing divide in education between boys and girls. So historically, girls have been disadvantaged on entering into school. In many parts of the world, that disadvantage has now been moderated, not totally eliminated, but moderated. Boys are increasingly leaving school before girls. So you're beginning to see an education gap there, with girls maybe slightly later entering school, but more likely to stay in school. So in a place like Kinshasa, nearly half of all boys say that COVID is going to reduce their education trajectory. That has tremendous consequences for the future. And when we think about services for young people, the education loss that young people around the world have sustained and are sustaining, because we are not in a post-pandemic society, we are in a pandemic society and environment. This educational impact is going to be huge. And how we put into place systems to address that are going to be critically important. Next slide, please. Let's just touch on mental health. Next. So what we see, we looked at 3 adversities that young people might experience: verbal abuse within a family, emotional neglect, and witnessing physical violence. And everywhere, young people report an increase in ACEs or adversities. And what the longer term consequences of this will be are yet to be seen. But when you look at this, you see Malawi at about 70% of young people, 7 out of 10, saying that adversity has had an increased impact on their lives. But you see it in Belgium, you see it in Indonesia, you see it everywhere. Next, please. We also looked at anxiety, and we used a scale, a general anxiety disorder scale. And anxiety is quite prevalent among adolescents for all sites, with the highest prevalence in Belgium, where over 2/3 of girls, for example, report high levels of anxiety. Where there were pre-COVID data that we had available, the level of anxiety between the start of the pandemic and now has increased significantly. And emotional distress is going to be an ongoing issue. The provision of mental health services to young people, and I'm talking about community mental health services, has never been very good. But post-pandemic world, the mental health needs of young people, I would suggest, are going to be vast. Next slide. The third of these dimensions of mental health is perceived stress. And again, when you look at this graph, what you see is that across all of the sites, at least moderately high levels of stress persist. And girls almost everywhere are reporting more stress than boys. But for both boys and girls, stress remains very high. Next slide. So in summary, we have issues that relate to family functioning and supportive families, particularly those disproportionately economically impacted. We have issues that relate to education and education loss. And we have ongoing issues of mental health that will be increasingly important to address in a post-pandemic environment. I'll stop at this point. Thank you very much.
Thank you so much, Dr. Blum, for that really insightful presentation. Just a reminder to all participants to please submit any questions in the Q&A. If you'll allow me to welcome our next panelist, Dr. Aatekah, please go ahead. Thanks so much.
Thank you very much, Paula. Good morning, good afternoon, and good evening, everyone. It is indeed an honor and a pleasure to be here with you today, presenting some of the work we've done at the Center for Global Child Health over the past year, looking at how the COVID-19 pandemic is affecting and in many cases upending lives of the most vulnerable across the globe. My talk will focus on how COVID-19 has already affected and will continue to affect health and nutrition outcomes for women, children, and adolescents in South Asia. Next slide, please. So COVID-19 has triggered a global economic crisis, which has led to disruptions in food systems and people's livelihoods, and which in turn has led to an increase in food insecurity and households being unable to access more nutritious foods. Per capita income in low and middle income countries is expected to have decreased by almost 8% in the last year, leading to an increase in the number of people living in extreme poverty and facing acute food insecurity. Countries which have a high dependency on food imports and remittance inflows are most at risk of widespread food insecurity. And within these countries, poorer households in urban slum areas are most likely to be affected, especially in the short term, due to the high number of daily wage laborers, increase in the cost of food, and lack of social support programs. As a result, childhood wasting is expected to have increased by almost 14% in the past year compared to 2019 levels. Next slide, please. So based on experiences from past health and economic crises, we conceptualized that COVID-19 could impact population health and well-being through multiple pathways, including reduction in health services coverage, disruptions in food systems, job losses, and disruptions in education. The economic crisis and school closures in tandem are likely to give rise to an increase in school dropouts as older children may choose to leave school and enter the labor market to support their families. But this, of course, comes at a cost to their future earnings, which would have been higher if they had been able to complete their education. And as we all are very aware, school closures have a gendered impact on girls, many of whom will get married early, especially in South Asia, and bear the higher risk of adverse birth and child health outcomes due to adolescent pregnancies. Next slide, please. Our work focused on South Asia's 6th most populous countries, namely Afghanistan, Bangladesh, India, Nepal, Pakistan, and Sri Lanka. And we used actual observed changes in health services and intervention coverage to assess the impact on maternal, child, and adolescent health, as well as the impact of prolonged school closures on educational attainment of children and adolescents. Next slide, please. What we found is quite alarming. In the second quarter of the last year, 2020, which also corresponded with the most stringent COVID-19 control strategies, such as lockdowns and stay-at-home orders, which were instituted in the region, coverage of essential health services declined substantially across the region, with family planning services and treatment for infectious diseases and severe acute malnutrition most critically affected. From July to December of last year, there was a gradual recovery. However, coverage of all essential services remained below pre-pandemic levels. And this is even before the rise of the Delta variant, which we know wreaked havoc in India and its neighboring countries in the spring of this year, and continues to drive surge in cases around the globe today. Next slide, please. I'll now talk about what we expect the impact on educational attainment to have been for children and adolescents in the region. There are more than 420 million school-aged children in South Asia, and they have been more or less out of school since March of last year. Although countries have instituted policies for remote learning, a report published last year by UNICEF found that 1 in 3 children in the region cannot be reached by any form of remote learning, with the proportion being much higher in rural areas and poorer households. And this was the best case scenario. The actual number of children who have had no schooling in the past 15 or so months is likely much higher. School closures can also lead to an increase in children who drop out of school prematurely. Again, based on experiences from past health and economic crises, we estimate that almost 9 million children in South Asia have likely dropped out of school over the past year, with consequences for this cohort's future lifetime earnings, which could decrease by up to 23% over their lifetime. And among the children who drop out of school, up to 67% of them are expected to be from households in the bottom 2 wealth quintiles, leading to increased income inequality over their lifetimes. Additionally, for the more than 4.5 million girls who will be among those who drop out, many will be married off early in the region. This will likely result in almost 500,000 adolescent pregnancies, with a corresponding increase in maternal and neonatal deaths, as well as low birth weight births and stunting in children by 24 months of age. Next slide, please. So what can we do to not only minimize the effects of the ongoing pandemic, but to also ensure that we are prepared for the next one? The major recommendation is to reestablish essential health services using interventions such as telemedicine. We know that cell phone penetration in low and middle income countries is quite high, more than 90% in several countries. So telemedicine is a viable option to ensure that routine health services are established and people are able to access care when needed. We also need to strengthen infection prevention and control for both healthcare service providers as well as people accessing healthcare in the form of adequate and enough PPE. And of course, to ensure that the supply chain and management of and delivery of essential commodities remains uninterrupted. We also need to focus on safe reopening of schools in the region. And some of the interventions to do so could be to limit class sizes, to institute alternate school days, as well as mask mandates and temperature checks for children and staff coming into the building. We also need to focus on safe transportation to and from schools to ensure that exposure and transmission is limited when children are traveling to and from schools. And last but not least, there needs to be an increased focus on social safety net programs for vulnerable populations, including children and adolescents. And with this, I thank you for your attention and look forward to an engaging discussion.
Thank you so much, Dr. Aatekah, for a really interesting regional perspective. If you'll allow me to welcome our third panelist, Dr. Spence, please go ahead.
Good morning, everyone. Good morning, fellow panelists and persons who are participating online across the globe. Next slide, please. So I just wanted to start a little talking about, what is the level of the problem we are experiencing here in Jamaica. And this data is from our recent Global School Health Survey, which was conducted in 2010 and in 2017. Can you click again for me, please? Just pointing out that about 24% of students are overweight, 9% of students were obese. And we see that propensity more in females than in males. And we do recognize that there's a significant relationship between obesity and lack of physical activity. Next slide. Here we're looking at the estimated number of Jamaican children between the ages of 10 to 19 who are suffering from high blood pressure due to obesity, and comparing the levels between 2010 to 2017. And we see again, there is more of a propensity for overweight and obesity in girls versus boys. And we also see that rather than heading in the opposite direction, we are increasing in terms of comparing 2017 to 2010. Next slide. Here again, we're looking at the change in rates between 2010 and 2017 in 13 to 15-year-olds in terms of the rates of overweight and obesity that are being experienced among this group of boys and girls. And again, the rates are increasing rather than decreasing. Next. In relation to alcohol and tobacco and other drugs, in terms of current use within the last 30 days, 45% of students would have had alcohol, 18% tobacco, and 13% cannabis or ganja. And we recognize that they do have ease of access to these substances. Next. 16% of 12 to 65-year-old Jamaicans were classified as harmful alcohol drinkers, and 15% were binge drinkers. Next. When it comes to mental health, 1 in 4 had made a plan to attempt suicide, and we see the propensity is higher in females in comparison to males. Next. And we had a 14% prevalence of depression, and of course, more females than males. Next. When it comes to violence and injuries, over 25% of students were currently being bullied, and 27% were physically attacked during the past year. Next. And in relation to unintentional injuries, males are more impacted and affected by this at 63%. Next. So in terms of the impact of COVID-19 on our health systems within country, and I'm sure this is the experience across all of our different spheres, is that it really has exacerbated our existing weaknesses within the health system. And using the health systems approach, in terms of service delivery, you would have had suspension of certain clinics focusing on really the emergency and very essential services, trying to focus, continuation of those services. And it has taken some time to restart some of these clinics, and some still have not yet been restarted based on the fact that the pandemic continues. In terms of leadership and governance, it would have delayed certain policy initiatives that were slated to take place over a period of time, especially with a focus on NCDs. The lack of electronic health information systems. We're still very much paper-based, trying to monitor and to get data so that we can provide targeted interventions. It can be very difficult, especially in this space. In terms of financing, the reallocation of budget to really support our COVID-19 interventions. And so there has been redirecting of funding to support these interventions instead of what they would have originally been prescribed for. In terms of our human resources, the focus, of course, is primarily on the COVID-19 response, as one would expect. And so some of the other services are tending to suffer. And in terms of medicines and technologies, we have seen the disruption in terms of the supply chain across the globe. And so we are no different in terms of medicines and technologies that we would need to support our different interventions. Next slide. So in terms of our strategic objectives as a Ministry of Health and Wellness, when it comes to NCDs, we want to increase by 10% the access to equitable, comprehensive, and quality healthcare for patients living with NCDs who use the public health sector by 2024. Next. And I'm going to focus in terms of what it is that we're doing on the two areas of the health systems approach in terms of leadership and governance and service delivery. And so one of our major accomplishments this year is that we were able to finally establish our National Committee on NCDs, which is a multi-sector advisory group. And it's across government sectors, include civil society partners. And we're hoping that with this level of buy-in from these sectors, we'll actually be able to implement our health and our policies approach, where we consider the health impact of the policies that are implemented across sectors. We have now our national policy for model of care for NCDs, which was developed in 2020. And we're now debating in Parliament our comprehensive tobacco legislation. And we have also presented our harmful use of alcohol policy to Cabinet for consideration and approval. Next. In terms of labeling of foods, we're in a very strong debate at this time in terms of FOP, front of package labeling, and nutrition facts panel, where we want to empower our population and our consumers with easy to understand information so that they are able to make informed choices and make healthier choices, because we recognize that the NCD pandemic in our country is only growing. And even though we have COVID-19, we cannot forget the importance of NCDs and its impact on our productive sector as well as the economics of our country. In terms of product reformulation, we're currently undergoing local research. We just launched our knowledge, attitude, and practices salt consumption study, and recently concluded our trans fat content study, so that we can have our own local evidence to support pushing our manufacturers and industry partners to reformulate their products so that we can have a healthier food supply chain within the country. And we're also about to launch our research in terms of marketing of foods, especially to our children. Next slide. We have established a teen hub centrally here in the capital city of Kingston, and we hope to establish another one. It should have happened, but again, COVID has delayed this, in the western part of our island, where teens, adolescents can have access to certain services outside of the formal health system, in terms of a health center or a hospital setting, where they can access various services, especially in terms of mental health and drug abuse counseling. Next. We also have adolescent-friendly health centers that have been established, a total of 44 to date across our 4 regional health authorities, and they have to meet certain criteria, 37 of them, in relation to these 10 standards which are shown there. And we continue to add sites every year, but again, COVID has delayed our rollout of, adding new sites. Next slide. In terms of service delivery, still, Jamaica Moves in School is one of our flagship programs, wherein we have introduced interim guidelines for beverages in schools, which was implemented in 2019, where we were having them, in terms of manufacturers, reduce the level of sugar content within beverages that are sold and served in schools. We have developed the National School Nutrition Standards, and we're working with the Ministry of Education, Youth and Information for the development and implementation of a national school nutrition policy in order to govern this nutritional environment within this particular space. Next. We have also done the same thing with physical activity, where we're trying to institute physical activity throughout all grade levels in our school environment for all school levels. And so this is an ongoing process which we hope to continue to push forward. And it's even more important now that online schooling is the mainstay, and the sedentary lifestyle is only exacerbated by this online schooling. And so the lack of physical activity is going to have a serious impact in terms of our obesity and overweight rates. So we need to continue to push this particular program. Next. Of course, when it comes to drug use and abuse, we have various prevention strategies which we engaged in, family-based, school-based, community-based, and as well as focusing primarily on our adolescents. Next. And some of our examples of our programs that we have instituted include Talk the Truth, which is really building capacity in peer educators. So they are peer trained and led high school interventions. Selective programs which build self-efficacy and life skills, such as our READ program, Resistance Education Against Drugs, which targets children in the 5 to 17-year-old group, as well as indicated programs for children that have started using substances, and our data is there to support this. The Step Up program, which tries to build life and resistance skills. Next. We have, because of this pandemic, been forced to, use all electronic means rather than face-to-face. So for our National Council on Drug Abuse, they have established tele-substance abuse counseling line. And, in 2019, we had 51 calls, moving up to 361 in 2020. The Ministry of Health and Wellness also launched our New Life helpline, which is for the general population, focusing on mental health issues within our population. And our Office of the Children's Advocate and Registry, with the support of UNICEF, would have launched Safe Spot, which is specifically for children and teens in terms of that helpline and WhatsApp line. So thank you so very much for allowing me to share, and look forward to the question and answer section where we can discuss and share some more. Thank you very much.
Thank you so much, Dr. Spence, for a really detailed presentation. If you'll allow me to welcome our fourth and final panelist, Dr. Kerry, please go ahead.
Hi, everyone. Thank you so much for inviting me to be a part of this very important discussion. I plan to give an insight from a personal point of view as a person living with an NCD myself, but also from a healthcare professional point of view from as I work in the government sector. Next slide. Hello? Can you hear? Oh, sorry, I'm not sure if you could hear me. Okay, so As I'm sure every country has experienced the severe lockdowns, we had the same in South Africa, where the streets were empty and everyone was forced to stay at home. On the bottom of that screen, you can see we are busy in our third wave at the moment. As of Monday, we moved from level 4 to level 3 lockdown. So actually, we have had 1 month where schools were closed again, but they were reopened on Monday. So as you can see, the pandemic has affected every single person across the globe. Next slide, please. So in South Africa, we have one of the highest Gini coefficients in the world, which is the difference in wealth between those. So 71% of the wealth is held by 10% of the wealthiest in our population, as compared to everyone else. And yeah, I just wanted to emphasize the differences in our care. So for myself, you can see me on the left there with my insulin pump and continuous glucose monitor for my diabetes. And that picture was taken in my gym. And just compare that and contrast that to the patients that I actually see with type 1 diabetes, who I can only offer biphasic insulin to, like very, very minimal strips, if at all, and poor insulin needles, which are often too long, especially for the thinner children. And just this contrast of what we have in South Africa, and COVID has actually exacerbated this difference that we are experiencing. Next slide, please. So why do we need change now that COVID is still ongoing, and it seems like it's here to stay, and into the post-COVID era? So we know that health is a human right, and even though we have such differences in our country, we need to work towards an improvement in this inequality. We know that NCDs need a focus regardless of what healthcare system you use. From a study that I did in the early 2000s, we've seen that regardless of public health sector outcome, children with type 1 diabetes are not achieving glucose control. However, glucose control was worse in the public sector. So it is divided, but both sectors are not achieving their goals. South Africa has a quadruple burden of disease. So we have trauma and related incidences, maternal and child health issues, infectious diseases, which is now only been more emphasized with the COVID-19, but over the last decade, 2 decades, HIV and TB have received extreme emphasis, and NCDs have sort of just been put on the back burner. And like I said, COVID-19 has emphasized that. Next slide, please. So what changes do we need? So from a healthcare point of view, from my point of view, working on the ground with these patients, is that we really need quality improvement in the healthcare services that we provide. So in our public sector, there is very little transparency and accountability of the healthcare that we provide, and the improvement of this and identifying patients who need help to avoid complications related to their non-communicable disease is a way to prevent further condition-specific related complications. And from a healthcare point of view, we really need to advocate for proper resource allocations to NCDs. I always compare HIV to diabetes. So in HIV, we have a specific care program that people follow and get regular annual blood tests, sometimes more if their control is poor. And compared to diabetes, where Our children and the other patients are not given test strips at all, but yet are expected to be injecting a life-threatening drug that, if overdosed, may induce hypoglycemic coma. And so I always ask people, how could you manage HIV without viral loads? How do you expect to manage diabetes without the proper testing equipment either? We also really need improved national guidelines on NCD management. We do have for adults, but in adolescents and children, there is really lacking guidelines on that. And to promote treatment inertia that is happening in our clinics and at primary healthcare level. So a large bulk of the patients we are seeing are not being titrated, their medication is not being titrated to achieve the goals of either blood pressure or glycemic control or lipid goals. And so we are getting those related complications that could have been prevented. And basically, our primary healthcare system needs an overhaul to really target preventative medicine rather than fixing problems once they have already occurred. And for me, one of the biggest things is that patients with NCDs need to be empowered for self-care, especially within diabetes. So I'm part of a WhatsApp support group with parents and children with diabetes, and I asked them their own opinions of what they think could be bettered within the healthcare system, especially now after COVID. And they said that they would really appreciate continuity of care. So seeing the same doctor every time, who knows their story, who they can relate to and develop a relationship with, they think would be beneficial. They also wanted practical advice. So instead of being told to eat healthily, rather being given ideas of healthy recipes and actual step-by-step guides of instructions. And they said that the support groups that we have need to continue, and especially for newly diagnosed patients with NCDs. And that's it. That's from my side of view from South Africa. As you can hear from all of the other speakers, we are all talking about similar problems and issues from children to adolescents around NCDs and how COVID has exacerbated all of these problems. So thank you for having me, and I look forward to any questions.
Thank you so much, Dr. Kerry, and thanks again to all 4 panelists. Just a reminder to everyone to please submit their questions in the Q&A that you should see at the bottom of your screen. Those were really interesting presentations, and I think very, very complimentary and highlighted a lot of the same issues across, you know, the national, regional, and global perspectives. I think what just really stood out was the maybe disproportionate effects on girls across the board, and just underlying inequities, you know, whether it's access to medicines or the you know, socioeconomic disparities that we are seeing just become more highlighted during the pandemic. I don't see any questions yet. Omnia, I'm not sure if you are still on the call. If not, I will just go ahead with the Q&A. If you'll allow me to ask I actually see one that just popped up now. It says, how do you see MNCH services getting affected by NCDs? I'm not sure who that's directed to, but if any of the panelists want to go ahead and comment on that, please do.
I can go ahead and take a stab at it. So a lot of the NCD care is given at healthcare centers. So if we see a decrease in coverage of MNCH services, such as facility birth, such as antenatal care, etc., I think it is quite likely that there will be a similar dip, if not a larger one, for patients trying to access care for non-communicable diseases. It is also likely that it may have been an even larger reduction in coverage for NCD care, because we did see and observe a large decrease in transportation available for folks, during the lockdowns that were instituted between March and July of last year.
And if I may just add, in total agreement, we had similar cases because persons in initial stages were very afraid of COVID, didn't know what to expect. And so they would miss their regular checkups, for NCD care, run out of medication, and then turn up hospitalized because of being uncontrolled or having complications as a result of their disease. And so one of the things in terms of once cases start to come back down, we had to actually try to encourage our patients to come back into the space, even though in a controlled manner, in order so that we don't lose as much gains as we would have made. And I'd also say that, we haven't had the data yet, but I'm sure it's going to also impact our children in terms of immunization rates, for the 2020 period, because again, a lot of services would have, regular service, routine services would have been disrupted as a result of the pandemic.
Thank you so much for that. There's another question. It's also an open question. Some of you mentioned that NCDs have been put on the back burner during COVID. Is that your general experience, or has COVID put global health on the top of the political agenda, which has drawn political attention to other issues such as NCDs? Please feel free to comment.
Maybe I can take that one.
Sure.
So here in South Africa, when the pandemic started last year in March, what the government's plan was for NCDs was to they increased the regulation on repeat scripts and increased it from 6 months to 1 year. So to allow so-called well-controlled patients with NCDs to just receive repeat scripts and basically have decreased visits to the hospital, and therefore decrease the exposure, like possible exposure to COVID, especially a COVID like dense environment such as a hospital. But the problem is that we didn't have strict guidelines on what qualified as a well-controlled NCD. So patients with hypertension and diabetes, exactly like the other panelists have said, just actually degraded in their management of their condition, and didn't have an ability to reach out, such as in private health, where telecommunication, like consultations were available. And so now, exactly as expected, we are now seeing further complications and further issues with NCDs. I do agree that health as in general is become more of a highlight, but it is still very much COVID related. That's the only thing people can think of, not, oh, should I be screening myself for breast cancer? And things like that.
Thank you so much for that.
I just wanted to add as well, even though we have now had to, here in Jamaica, try to pivot the conversation now to say, yes, COVID is here, we have to live with it. Now let's refocus again on NCDs, because that is the pervasive pandemic. COVID will come and go eventually, even though it will take some time to go, but NCDs and this problem did not develop overnight, and it certainly is not going to go away overnight. And so we cannot afford to totally lose focus. It's really trying to recenter not only the internal customers, meaning the healthcare workers, but also the general population, to recognize that with COVID exacerbating the health impact of NCDs, it's even more important for us to pay attention to make sure we don't lose sight of those goals that we would have established before.
Thank you so much for those insights. We've actually run a little bit out of time. If you'll allow me to hand over to Alafia for the closing remarks. Thank you so much.
I was muted, sorry. Thank you very much. I really a special thank you to the 4 panelists. I mean, I think the presentations were very complimentary, looking at actual impact of COVID in service delivery on the ground in Jamaica and South Africa, hearing about what happened, the research in South Asia. Some of those figures are staggering, the millions of children who are out of school, the impact, this is gonna a generational type impact in terms of reduced earning capacity going forward. And of course, we know that the poorer you are, the more vulnerable you are to NCDs. And that includes children in poorer income households. And we're gonna have more poorer income households and greater inequity between rich and poor. And so we really do have a challenge going forward. And I think that our response to the COVID pandemic, which has come on top of the NCD pandemic, is going to really test our capacity to have resilient health systems going forward that can be more flexible. And of course, with the use of technology, some of the good, I don't know if I can call them that, things coming out of COVID have to do with, for example, the increased use of technology and so on. So we are hoping that going forward, we can do our very best to catch up on some of the losses that we have suffered due to the COVID epidemic, and to not lose sight at all of the NCD epidemic that is ongoing. So thank you all very much. And we thank NCD Child's administrative support team who put all of this together. Thanks to the moderator who shared duty with me. And a good morning, good afternoon, and good nights to you all. Thank you.